Today we're going to look at extended assessment. So this is quite a short session on extended assessment, but when undertaking extended assessment in any circumstances, really keeping a systematic approach will stand you in good stead. So an A to E for a non-pregnant person and an A to F for a pregnant person. And so starting at A, we're looking at airway. So how can you tell if someone's airway is obstructed or if they are needing some assistance there? Well, clearly I am a normal colour for my ethnicity and I'm talking to you, so there's clearly not a problem with my airway. And you can be relatively assured for most people if they are talking normally and their colour is normal, that their airway is patent. If there is no sounds coming from the airway at all, the chances are this person is unconscious, and so you need to think of urgently opening that airway, so head tilt chin lift, and maybe positioning them in a recovery position if no further resuscitation measures are needed. If they're making gurgling sounds, this might happen after someone has vomited, but their level of consciousness has been affected perhaps by drugs or post-eclamptic fit. Then the stomach contents may still be in their oropharynx, and that may be partially obstructing the airway, so you may need to use suction to clear that, and then your head tilt chin lift to ensure that that airway remains patent until they're breathing for themselves. If they're making sort of snoring or stridor noises, which you may or may not have heard, that would deem that there's a partial obstruction. They're getting some air in, but not all. And often a stridor sounds like sort of so you can sometimes hear it with people who maybe have got something caught in the back of their throat. So you can either deal with that, you may need to look at the position that they're sitting in. If it is an obstruction from a foreign object, then obviously you need to initiate your basic life support manoeuvres and choking manoeuvres to clear that obstruction. Consider high flow oxygen, 10 to 15 litres via a non-rebreather mask, and the picture on the screen shows you a non-rebreather mask, and these have the bag underneath, and it's important that you inflate that bag first before you put it on the woman. Now, in order to do that, you put your finger, there's a little valve just inside the mask over where it joins the bag, and you put your finger on that as you turn the oxygen on, and the bag will inflate. It has a little membrane that flaps open and shut when people breathe, and your finger on it really just seals it in order for the bag to be able to fill with oxygen. So moving on to breathing, so have a look at them. What is their colour? Is it normal for their ethnicity? Do they look pale? Do they look blue? Do they look cyanosed? What is the breathing rate? Is it normal for them and their individual circumstances? We're thinking of a normal respiration rate somewhere between 12 and 20. So if it's on the higher ends or above that, you need to be looking as to why is that. Looking at the chest, have you got bilateral chest rise? Okay, is it equal on both sides, or does she seem to be having any signs of respiratory distress? So are the little muscles in between her ribs, are they sucking in when she's breathing? Is she stomach breathing? Very much like babies, really, when you're looking for signs of respiratory distress. If you were to auscultate with a stethoscope, can you hear anything, crackles or wheezing? The auscultation and percussion very often are done by doctors. We're not generally trained to undertake those. Percussion is where they tap their fingers across, and they're really looking to see, is there any perhaps any fluid in there? It will change the sound that they're getting back. But oxygen saturation levels is something we can do, and we need to attach a saturations monitor either to a finger or a toe. Ideally, one that hasn't got nail varnish on, but in these days of gels, that can be quite problematic to get gel off. And you really want your SATS levels to be above 95%. And you would administer facial oxygen to help you achieve that. But also you need to, if they're not achieving it without the facial oxygen, you need to be looking for why are they not achieving it. Then moving on to circulation. Okay, so looking at their skin, is it appropriate for their ethnicity? If we're looking at Caucasian women, are they pink? Is it blue? Is it mottled? Do they feel warm? Do they feel cold to the touch? Looking at capillary refill, and this tells you really about your circulating volume. If you press on the sternum until the skin blanches and then you release your finger, so press on the sternum, release your finger, it should refill within less than 2 to 3 seconds. Okay, that tells you you've got a good circulating volume. It's getting the blood back to that area fairly quickly. We used to also press on nail beds. The issue with that is, yes, you will see your capillary refill on that, but if they are perhaps in shock, then they're likely to be vasoconstricted, certainly peripherally, and therefore you're not likely to get a very good peripheral refill in those extremities. What about heart rate? Is it within a normal range that you would be expecting? Again, if they are peripherally shut down, then radial pulses might be a little bit tricky to actually locate, and you may be better to try and feel a carotid pulse, a more central one. Blood pressure, do them on both arms. Is it the same on both arms? Saturations we've already discussed in breathing, and you may need to consider an electrocardiogram, so monitoring their heart. Is there a problem with their heart? Certain women we look after, certainly women who are on magnesium sulfate, may need an ECG, as this can have an impact on their cardiac function. We may need to cannulate, we may need to think about bloods, and we also may need to think about fluid administration as well in order to support that cardiac function, that circulation. So moving on to disability, really this is very much about what is interfering with their level of consciousness, if anything, so their CAVPU. And CAVPU stands for, C is for confused, and this came in a few years ago. So are they confused? Are they alert? Do they respond to voice? Do they respond to pain? Or are they unconscious? Have a look at their pupils. Are they equal? Are they the same size? Do they react to light? Are they fixed and dilated or fixed and pinpoint? Certainly some drugs can affect how people's pupils are. Are they in pain? If so, where? Have they taken any drugs? Are they on any drugs? Could they have been an allergic reaction that we're looking at? And don't forget blood glucose. Okay, hypoglycemia can cause change in people's consciousness, their level of consciousness, and also their mental status as well. They can become quite agitated and confused, and if we don't correct it, they can lead to seizures as well. Have they got seizures? Have they had seizures? Is there a head injury going on there? And then looking at exposure. And this is more than just checking their temperature and keeping them warm. It is the top to toe examination. Is there any obvious signs for the problem that she has presented with? For example, if she has collapsed and you lift the blankets and you see she's sitting in a substantial pool of blood, you can be fairly sure that you're looking at possibly an antepartum or a postpartum hemorrhage of some description. So look and see, is there any obvious signs? Is there any injuries that you can see that may be causing the issues? And this would be where, in a non-pregnant person, your extended assessment would cease. However, if you've got somebody who is still pregnant, then you need to add that F in, because we need to consider the baby. So we need to consider assessing the baby. What gestation is she? What is the most appropriate method of monitoring that baby? You do need to consider that in law, the baby has no legal rights until it's actually born. So your efforts really are very much focused on the mother. But ethically, we do obviously consider the baby as well. So position of the baby, position of the mother. Do we need to put her in any particular positions to facilitate better oxygenation for the baby? Do we need to consider delivering the baby? Positions really we'll go into in a little bit more for things like cord prolapse. And there we have it. So if you keep a systematic approach from your extended assessment, you won't miss anything out. And there we have it, extended assessment. I hope you found it useful and look forward to seeing you next time.